Hi guys, I'm Dr. Dana.
And I'm Dr. Miro.
And today we're reacting to the premiere of Grey's Anatomy. I've never seen Grey's Anatomy before. This is my first time seeing it.
Can't believe it.
So this is part 2 of the episode. If you haven't seen part 1 already, go to Dr. Miro's channel. We'll put the link right here. Watch that and then come back. All right, let's get started. So we're going in for an appendectomy.
He's gonna faint. He's a fainter.
Nah, Coach says he messes up the McBurney.
50 says he cries.
I'll put 20 on a total meltdown.
50 says he pulls the whole thing off.
I have never seen an OR like this.
That's what I was about to say.
These people watching an appendix being removed, like, they got other things to do.
Low-key, appendectomy isn't a very exciting surgery. And also, I've never seen one where they're just all looking down like that. Have you seen one?
No.
Pickups?
Pickups.
Supposedly, he's never done this before, but he knows exactly what to do.
Yeah, the guy is about to take out the appendix by himself as a first day intern.
Like, I've never seen this, but I can just feel it.
Yeah.
All of their goggles are missing. You need to wear goggles, especially in something like this, because blood tends to squirt.
What do you need?
Mr. Jones has chunky veins and he really needs antibiotics. I should start a central line.
You start one.
Would you start a central line for junky veins?
I mean, if you had to, but you kind of have a lot of other options, and central lines, they're not risk-free procedures.
You don't know how.
I've never done one.
Well, you know what that means.
And that means see one, do one, teach one. And to see one, you gotta wake up your senior and they gotta show you.
I do relate though. When you are first starting out, you might sometimes get nervous trying to call the senior or call the attending because you want to do these by yourself, but at the same time, sometimes you just need to ask for help.
Wait.
Oh, they're going to shock.
Oh, this kills me. When the heart is stopped and it's flatlined, you do not shock the patient. You can only shock the patient if they have an arrhythmia.
When the heart has just stopped, you need to immediately start chest compressions.
Blood pressure's coming up.
Pressure's returning. Rate's coming back. What did you just say? Did you just call me a nurse?
I mean, female residents do get confused with nurses a lot more than male residents.
Some of my female colleagues actually carry badges that say MD specifically because of this problem.
I put you on a bypass machine, which pumps blood for your heart. Fix your ticker, take you off the machine, I'm done. Simple procedure.
So
Just a simple procedure.
Yeah, it's just go and bypass.
Yeah.
he'll be fine, right?
Tony's gonna sail through. You have nothing to worry about. It's a promise.
That's really hard. Right.
Yeah, you want to reassure the patient, but at the same time, you want them to understand that there are risks.
Providing reassurance is great, but it has to be realistic. Bypass surgery is not a low-risk surgery. It's a high-risk surgery. That's what he's having. The only time you take off your mask in the operating room during the operation is when the operation's over.
Gloria, there were complications in the surgery. Tony's heart had a lot of damage. We tried to take him off bypass, but there wasn't anything we could have done.
What are you talking about?
You know, the first time giving patients bad news is really hard.
Yeah, but this is not the way to do it. I mean, you have to get the family in a quiet, private room where there's no background noise, not in the middle of a hallway. We have rooms like this in the hospital where you can discuss things with the family.
He's still short of breath.
Give the antibiotics time to work.
The antibiotics should have worked by now.
She's old. She's freaking ancient. She's lucky she's still breathing. I got a shot to scrub in downstairs with a patient who wasn't alive during the Civil War. Don't page me again.
If a nurse pages you, you listen. You take what they say seriously.
They spend the whole day with the patient. Nobody knows the patient better than them. You have to listen when they call. You can't just like, don't page me.
And if you act like that, the nurse might just go above you, go speak to the attending, which is the doctor that's more in charge.
And that's gonna come down on you.
You said it was a seizure disorder. Now you're saying it isn't?
I'm saying that I don't know.
Well, what do you think it could be?
I don't know.
When will you know?
I mean, sometimes you have to be honest with patients and say you don't know.
The best doctors are very comfortable saying, I don't know. But you can't just say, I don't know. You have to follow up with something like, oh, we're doing X, Y, Z. This is how we're trying to get the diagnosis. Because otherwise, if you don't say that, the patient or the family may think you're not doing anything.
What you possibly need is a angiogram. Oh, Dr. Shepard, just one moment. Katie completes some beauty pageants.
I know that, but we have to save her life anyway.
Okay, she has no headaches, no neck pain, her CT is clean. There's no medical proof.
They just said the patient's full name and now they're talking about their medical history.
Like literally everybody in the elevator is listening to all the medical history. They're breaking a law, it's called HIPAA, and if somebody reports them, they're literally liable for millions of dollars. Millions.
Proof of an aneurysm.
Right.
But what if she has an aneurysm anyway?
Well, you know what the chances that a minor fault could burst an aneurysm? 1 in a million, literally.
So dramatic.
Let's go.
Where?
Find out if Katie's 1 in a million. I'll be damned. There it is. It's minor, but it's there. It's a subarachnoid hemorrhage. She's bleeding into her brain. All right, everybody. It's a beautiful night to save lives.
Why is his voice so high?
Let's have some fun.
They just don't want to tape things very well. Like that breathing tube's gonna fall out.
They make it hard on purpose. There are lives in our hands.
Yeah, it's true. I mean, it's hard on purpose. Like you have people's lives in your hands. One mistake. See the way they look at each other.
I did, yeah.
See you around.
Calm down.
See ya.
See?
Big dreamy.
So, I made it through my first shift. We all did.
That was fun.
Yeah.
Yeah. So I remember watching Grey's Anatomy when I was in high school. And I was an EMT. It was usually like during a long shift when you had a little bit of downtime. And I was like, oh, this is so exciting. This is the way medicine's gonna be. I was like really excited. And watching it as a doctor is very, very, very different. Very different. And you've never seen it before, so what did you think?
I thought there were a lot of things that were realistic, but then a lot of things that were not as well.
Yeah, because you see, going from medical school where you're all about books into residency is a huge transformation. You go from a student into a doctor, and there's a lot of things that happen inside emotionally, and there's a lot of things to get used to, and there's a lot of room to grow into. And this show does point out a lot of the feelings that people go through. And it's a challenging time. And it's a time of a lot of growth, a lot of personal growth and development.
Well, we like to laugh at all the things that were not very consistent with reality, but honestly, there were a lot of moments, like you said, that were very realistic. And I can see how it would be a fun show to watch. It's very dramatic, it's a very fun plot line. I can see why people like it.
Yeah, I mean, it's entertainment first, but there's a little dose of reality in there.
Exactly. All right, guys, that is a wrap. Don't forget to subscribe to both me and Dr. Miro to get more fun videos like this. Don't forget to hit the like button, that helps us with the algorithm, and turn on the bell so you get notified whenever we make new videos.
And let us know in the comments if you want to see more videos like this, and what else do you want us to react to? Maybe The Good Doctor or some other medical show.
Or Scrubs.
House. See you again soon.
Bye.